this module, we will discuss about acute coronary syndrome, a term that encompasses all patients who are presenting with chest pain, whom we are going to further decide on what kind of chest pain do they have. Is it primarily cardiac, and when it is cardiac, what is the further nature of the syndrome. Whenever a patient presents with chest pain, the first thing, like anything else in the emergency department, in the critical care department, our first goal is resuscitation. We think of the airway, breathing, circulation at all times, and we want to primarily resuscitate the patient to ensure that life is saved. Subsequent to that, our secondary goal, particularly in patients presenting with acute coronary syndrome, is pain relief. While we are trying to make a diagnosis and initiate therapy, all that the patient really cares for is being relieved of his pain, because a lot of the times patients describe this as the worst chest pain that they've ever had in their life. Now, as we provide pain relief, we are also going to initiate measures that would help with our diagnosis, and subsequently we are going to plan appropriate reperfusion strategies and initiate therapy to prevent further thrombus, while also planning adjunctive therapies, particularly as the patient is getting moved to the ward and subsequently getting discharged. So this would be our general plan of action for all patients presenting with acute coronary syndrome, and we will illustrate several aspects of this using case scenarios that all of us are probably familiar with while managing patients with chest pain. Let's start with this patient, a 56-year-old who is previously healthy, comes to the emergency department with a history of crushing pain in the center of the chest radiating to the teeth. A typical kind of cardiac chest pain would usually present as a crushing chest pain, often associated with other symptoms like breathlessness, perspiration, and maybe radiating to the upper jaw and to both sides, right and left, up to the shoulder. This patient is also sweating profusely, and as you can see, his heart rate is elevated at 112, his blood pressure is kind of borderline. Oxygen saturation is 96% on room air, and note this while I am discussing with you on the next slide. And his respiratory rate is increased at about 26 per minute, and his chest examination does suggest a few basal rales, which may make you think about possible associated congestion, and his heart sounds are normal. Now, when we think about this patient, and I am using a question to illustrate this on various aspects, we would